Hi everyone. We are still waiting for some people to join us, so just bear with us for a bit more, and our session will be starting in a short while. We'll be having two amazing speakers with us tonight. We have Dr. Michelle Perugini. She's the CEO and co-founder of Precision, the company that introduced Life Whisper, an AI embryo assessment application that's now available in Alpha. Apart from Dr. Michelle, we also have the founder and medical director of Alpha IVF Group, Dato Dr. Colin with us today. It's actually very hard to get both of them to join us together. So tonight is a very rare opportunity. So please share this out, and I promise you it's going to be a very informative and interesting session. All right, I think we have most of the people with us now. So let's begin our session today. Good evening, everyone. Thank you for joining us today. My name is Jape, an embryologist from Alpha IVF. So Alpha IVF is set up and run by leading doctors and embryologists who actively involve in the development of innovative fertility treatment procedures. And over the years, our work in IVF industry has led us to many first achievements, both in the region and worldwide. So today, we would like to introduce you to one of the newest technologies in IVF, which is the use of artificial intelligence, AI in short, in IVF. In particular, today we'll be exploring on an AI embryo assessment application called Life Whisper. I'm actually very excited about today's session because we have been a collaborator to Life Whisper for the last couple of years in the development of current Life Whisper AI model. In fact, Alpha IVF is the only IVF center from Asia that was involved in the study, together with 9 other IVF laboratories in USA, Australia, and New Zealand. Today, we couldn't be more excited to have Dr. Michelle Perugini and Dato Dr. Colin with us to discuss on the use of AI in IVF treatments. Dr. Michelle Perugini is an internationally renowned expert in health, medical research, advanced analytics, and of course, artificial intelligence. She's the co-founder and CEO of Precision, an AI healthcare company based in Australia that focuses on building scalable AI products for women's health. The Precision's first commercial product in the market is called Life Whisper, an AI application for embryo viability assessment during IVF. Life Whisper is now approved for sale in 2/3 of global market and has initial clinical customers in 6 countries. Our second speaker today is Dato Dr. Colin the medical director and founder of Alpha IVF Group. She is an internationally recognized leader and innovator in the field of fertility technologies. Over the years, Dato has set up several medical and fertility centers, including Damansara Fertility Center, TMC Fertility Center, Alpha Fertility Center, and now Alpha IVF Group, which consists of Alpha IVF and Women Specialists in KL, Alpha IVF and Women Specialists in Singapore, and Genesis IVF Center in Penang. Dato has constantly involved himself in innovating various fertility treatment processes, which play a large role in increasing pregnancy rates. In today's session, we'll be exploring how artificial intelligence can actually play a role in IVF. And then we'll see how Life Whisperer can be used to assess an embryo viability, as well as improving a patient's IVF outcome. And of course, how Life Whisperer AI is available and can be applied to our patients in Malaysia. So let's waste no time. We'll first start with Dr. Michelle. So Dr. Michelle, the floor is yours.
Thank you so much, and I really appreciate the opportunity to talk to you all today. Thank you for joining the session. We're very excited because we have been working with the Alpha Group for a long time now, and they've been fabulous collaborators, but I think one of the unique things about the Alpha Group is that they are quite innovative, and this is cutting edge new technology, and it's very exciting. It's bringing knowledge from around the world and packaging it up into a software program to help us to improve outcomes in IVF. So it is a very exciting time for us. I would love to share my screen now and talk a little bit through a couple of slides, if you don't mind. I'll just share that now. Excellent. So we're looking at AI enhanced fertility. How can we use artificial intelligence to really help improve patient outcomes during the IVF process? And what you may or may not know is that artificial intelligence is actually already being used and is already impacting the IVF laboratory significantly in many different countries, and many different labs have adopted some of these technologies already. What I'll be talking about today is a little bit about the background of artificial intelligence, how we build these products, and then how they can be applied to embryo quality assessment for ranking of the best possible embryo for selection and transfer. But there's other areas like oocyte and sperm assessment that we and others are also looking at now. There's also AI-based assessments of genetic screening results. There's non-invasive embryo genetic assessment, which I'll talk a little bit about as well. And then there's stimulation protocol optimization. And even in Europe, there's a facial recognition for donor selection, which is a really interesting and pretty innovative type of technology. So AI has the ability to really impact a whole range of different parts of the IVF process. But of course, when we're thinking about the embryo, selecting the best embryo or the healthiest embryo in IVF is really critical to having a successful pregnancy. And at the point of embryo transfer, there's a decision that needs to be made about which embryo should be transferred in order to hopefully lead to a successful pregnancy and live birth. And when we talk about embryo quality, what we really mean is two things. Viability, which is the implantation of the potential of the embryo, so the likelihood that an embryo is going to achieve a pregnancy. And then genetics, which is around, is that embryo genetically normal or abnormal? And both of those together make up embryo quality and determine whether there's a healthy and successful pregnancy. So what we have done with Life Whisperer is used AI for both viability assessment and also genetic assessment to be able to give this embryo quality measurement, if you like, using data and artificial intelligence to be able to assist with making that decision. And really all it does is takes a huge amount of historical data of embryo images where it knew whether there was a positive or a negative outcome, and then it builds its own algorithm or a computer model, if you like, that can really accurately assess new images of embryos and score them according to their likelihood of generating a successful pregnancy. So it's very exciting. But I want to dig a little bit more into what it means to do feature assessment or embryo assessment using artificial intelligence compared to what is commonly used within the IVF laboratory. So for many, many years, there has been numerous different scoring methods. The Gardner score is one of those that we can use to grade embryos to assess their quality. And the Gardner score is really a visual assessment. So an embryologist will look down a microscope and they will look at certain features, certain parts of the embryo, such as the ICM and the trophectoderm, and how expanded that embryo is. And they will give those embryos a score on the basis of those characteristics. But the AI is actually very different. It's identifying many more features that are not captured using the Gardner scoring method, and it's far more complex. So what the AI does is it identifies really complex patterns and features within the embryo that lead to, that are related to whether pregnancy outcome has been achieved or not. And many of these features, not only are they complex, but they're invisible to the human eye. So it's not something that we can grade. It's not the fact that we haven't perfected the grading score. is the fact that the AI just has the ability to compute in many different ways and assess many complex features of those embryo images. So how do you build one of these AI systems? It's really actually, this looks complicated, but it's quite simple. You get a training data set of many different images from many different laboratories, representing many different patients and their embryos, and you need to know whether pregnancy resulted from those embryos. And then you use AI training and a whole series of other steps to be able to build what we call a model that can predict, or that is based on those embryo images that you feed it and the matched outcomes. And essentially it can just classify new images according to which embryos it looks more or less like in that very large historical training data set. And so it's really classifying embryo images according to their outcomes. And then there's a whole range of other sophisticated methods that are used to be able to not only normalise the large amounts of data that come from all those different laboratories, but then also to do things like segmentation and annotations, which is all automatic within the system, looking at very specific parts of the embryo that we know to be important factors of embryo quality. And we train the computer model to be able to look at these things in an automated way. So essentially, if you think about it, you're taking data from all of these different laboratories all around the world, you're training the best possible AI that you can to be able to assess those embryos. And essentially, you're bringing the expertise and knowledge of the very best embryologists globally into one single computer system. And it's quite effective. So, of course, in order to get approval for these types of products, you need to go through very rigorous clinical testing and validation, and then go through the regulatory approval process in different countries. And we've done just that. We built this model over the last 3 to 4 years. We have done extensive testing and collaboration with clinics all across the world. I think there's around 20 to 25 clinics now that have been part of various parts of the testing process. And what we've shown consistently is that there's around a 25% accuracy improvement of the AI compared to that standard visual grading. And that's really important, because what that means is that we can see reduction in time to pregnancy for patients, and that means reduced number of IVF treatment cycles, and obviously a reduced cost for patients going through what is quite a stressful and traumatic process going through IVF. So again, we're trying to achieve much, a more scientific approach and lower the time to pregnancy for patients so that no one needs to endure additional cycles. I want to switch just really quickly now to talking about the non-invasive genetic assessment, because in the similar way to how we have built the viability assessment, we can also feed the AI the PGTA sequencing data that shows chromosomal level changes or genetic defects, if you like, within the embryos. Now, one of the challenges with PGTA is it is an invasive process. It requires biopsy of an embryo in order to get that genetic sequencing results. We have come up with a genetic pre-screen and trained an AI to, based on that sequence data, to be able to non-invasively assess just from the embryo images whether they are likely to be genetically normal or not. And that gives us what we call a euploidy score. And we've done extensive studies with this Life Whisperer genetics as well, where we can show that if we have 91,000 randomised cohorts of patient embryos, so collections of patient embryos, where we know that there's at least one normal embryo within each of those batches, and then we use Life Whisperer genetics to rank those embryo cohorts, 82% of the time, Life Whisperer genetics correctly ranks the top embryo as the genetically normal one. So it ranks that euploid or normal embryo right up the top. And 96% of the time, that euploid or normal, genetically normal embryo is ranked in one of the top 2 ranked embryos. So you can imagine that when you're going through an IVF treatment, if you have both the viability and the genetics assessment, then you've got a much higher chance of being able to select not only an embryo that is more likely to lead to a pregnancy, but one that is likely to be genetically normal. And that's incredibly powerful. One of the other aspects of our system that patients really love is the transparency. So I think often when we're given grades or scores from our embryo evaluations, it can be quite difficult to interpret what those scores mean. And so we provide a really nice patient report for every assessment that's done using Life Whisperer, which really in this middle section shows what the scores mean and how many patients within each of those scoring brackets became pregnant from that very large historical data set. And that gives you a very good expectation around what you can expect and whether you are more or less likely to achieve a pregnancy from that embryo, and also the ability for the embryologist and the clinician to be able to select the very best embryo for transfer. And the same goes for the genetics. This is the genetics report, and as you can see in the lowest scoring bracket in the middle panel there's a much higher chance, or a much lower chance rather, of those embryos being euploid. And with the higher scoring embryos, there's a much higher chance of them being genetically normal. And so this is just, again, a really nice way of being able to rank and order embryos for transfer. So I guess just generally, many of the benefits of the system are for patients. So it's around shortening the time to pregnancy, putting more scientific rigour around the evaluation process of the embryos. It is quite a low-cost solution, and so that's very helpful. For clinics, though, and for IVF labs, it's also incredibly useful because it standardises the whole embryo assessment process, and it's an objective score that's based on a historical data set of many, many thousands of embryo cases. It can also create some significant efficiencies and doesn't require any additional hardware. So that's the benefits of the system, and that concludes my talk. So I will stop sharing. And I would love to, once we've heard from Dr. Lee, I would love to take questions from the audience.
Okay, thank you, Dr. Michelle, on the sharing. How exciting to actually learn that there's a platform that can help us in selecting the most viable embryo. It can most likely to lead to successful pregnancy. What an impressive work from Precigen. Thank you, Dr. Michelle. So next, let us welcome the Dato Dr. Colin Lee, the founder and medical director of Alpha IVF Group, to explain on the use of Life Whisperer in Alpha IVF, as well as some exciting achievements that we have achieved so far. So, Dr. Lee, you may start now.
Well, the use of AI is increasing in our everyday lives, in technology, in the various applications in life that we are experiencing. So it is not surprising that AI has finally found its way into the field of IVF. And in fact, we are very happy that the day has come that we can actually deploy artificial intelligence in helping patients to have a better outcome and a faster outcome in IVF. And we were very privileged that we could work together with Michelle Perugini of Precigen, together with 7 other IVF companies from around the world, to collaborate in coming up with this first platform, clinically usable platform, using artificial intelligence to improve IVF outcome. So to go straight to the point, what is the indication for artificial intelligence in the use of IVF? Basically, it's very simple. If you have 2 embryos or 2 blastocysts, and you need to decide which one that you want to put in first into the uterus, we can use AI, and in particular, the one that is available now from a Life Whisperer, to help you to make a decision so that the chances of having a viable pregnancy is higher. So whether you have 2 blastocysts, or in the case that we had a total of 23 blastocysts to choose from. And we use AI effectively to choose a blastocyst that resulted in a successful pregnancy. If the blastocyst or embryo had already been tested using pre-implantation genetic testing for aneuploidy, or in layman's terms, if these embryos had already been tested for its chromosomes, and we have at least 2 embryos or more that are chromosomally normal, then again, we can use AI to help us to choose which is the one that we want to put into the uterus. So this is certainly something very useful, because as a clinician, as a doctor, we often have to make difficult decisions as to which is the embryo or the blastocyst that is most likely to result in a pregnancy. Next slide, please. So what we want to know as doctors and also as a patient is, if we use AI compared to what we have been using all this while, what is the increase in the pregnancy rate? And if we were to use AI in patients that did not have pre-implantation genetic screening done, then there is actually an increase of up to 32% in the clinical pregnancy rate. If someone already has the embryos checked for these chromosomes, and the chromosomes have already been found to be normal, and on top of it, we use artificial intelligence using the Life Whisperer platform, we can actually have an increase of up to 25% in the clinical pregnancy rate. So you can see here that AI is an adjunct, it is an additional tool that we can use in the selection of embryos and blastocysts so as to have a higher clinical pregnancy rate. What this ultimately leads to is, next slide please, is that by using AI in whatever circumstances, as long as we have more than 2 embryos to choose from, the implantation rate is increased and the pregnancy rate is also increased. And this effectively means that the time to get on to a pregnancy is actually reduced, and also the number of IVF cycles as needed to achieve a successful pregnancy is also reduced. And to the patient, it's very important as well, because IVF is expensive. And by using AI, which relatively is cheap, we actually reduce the cost in order to achieve a baby. So in a nutshell, this is what the use of AI is in IVF. It is still very early days. Our experience is very little, and worldwide experience is still new. However, the use of AI looks very promising indeed. In our own practice here, we started using AI just very recently, and we are happy to say that in the first 2 patients that we use AI, both the patients resulted in a pregnancy with a baby's heartbeat seen on the ultrasound scan. The first patient is just to illustrate so that you can actually relate to real life cases. The first patient that we actually did using AI was in a 35-year-old lady who produced a lot of embryos. And in fact, she had 23 blastocysts to choose from. So we use AI, and in fact, we had to make a decision whether you use AI in the Life Whisperer platform or to use another algorithm that we were previously using, and we choose AI over the other one, put in the embryo, and the patient became pregnant. In the second case that we did was a patient that had failed multiple times of IVF using whatever technologies you can think of, and she decided that she'll have one last go. This patient is in the early 40s, and we thought that, okay, since AI is new, we wanted to use AI. In fact, we use AI instead of the other technologies that we were using before. And because it was her last try and she's in her early 40s, we put in 2 blastocysts chosen from AI out of 4, and she resulted in both embryos being viable, meaning that she had resulted in a twin pregnancy. So the first 2 patients that we ever tried on, of course, this is something new, and we were, of course, we cannot make conclusions yet, but then we put in these 2 embryos. In these 2 cases, we put in embryos based on AI, and both resulted in a pregnancy. So it tells us that the use of this AI platform is indeed very promising, and we will certainly want to build up on this experience, and we are confident that it will add value to patients wanting to do IVF, with patients who has at least 2 embryos to choose from. So this is to share with you our experience, which is very early stages, I must emphasize, but I believe we are all heading in the right direction, and this is certainly a great start in the use of AI, which we are very happy has now found its way into the field of IVF and being able to contribute positively to patients' experience and patients' outcome. So again, we say that we are very privileged that we can work with innovators like Michelle, and to be able to bring something useful to the field of IVF and to help patients.
Right. Okay. Thank you, Dr. Lee. Once again, thank you, Dr. Michelle and Dr. Lee, on your sharings today. It's so glad that we have the 2 speakers with us today to present us one of the newest technology in IVF in a way that everyone can understand easily. So to our viewers, if you have any questions regarding the use of AI in IVF, please feel free to drop your question to the comment box below. We'll try to answer as many as possible. Okay, now we have the first question. How does Live Whisper analyze a blastocyst? Which parts does it analyze? I guess this question is for you, Dr. Michelle.
Thank you so much, and thank you to Dr. Lee for walking through your experiences. It really is very exciting to see the positive patient outcomes. In terms of how Live Whisper analyzes blastocysts, it's really training or learning from historical cases. So if you've got 10,000 embryo images where we know whether a pregnancy resulted from other cases in different clinics, then the AI is essentially learning which features are in those embryos that relate to whether a pregnancy occurred or not. And then it's able to classify what those features look like so that when it sees another embryo image, it's able to very accurately assess whether it looks more like a healthy one that led to a pregnancy or whether it looks more like an unhealthy one that did not lead to a pregnancy. And so it's essentially a library of features that relate to pregnancy outcomes. And that's why it's such an objective score. And I guess one of the other questions that I could see coming up in the chat is it actually better than the traditional Gardner grading or scoring methods? And the answer is yes, because even though there's a strong overlap between them, which you would expect because we've been learning about these different techniques for a very long time, there's about 70% overlap between the Life Whisperer score and the traditional grading score. But in that additional 30%, Life Whisperer actually performs a lot better. And it's because it's looking at things, more complex features that you just can't visualize or compute with the human eye. And so it's taking a different, it's making a different opinion, if you like, or taking a different lens on how it views those features of the embryos.
All right. Okay. Thank you, Dr. Michelle. There's actually another question for you. Can Life Whisperer be used to assess day 6 or day 7 blastocysts as well?
We have done quite a bit of research in the day 6 blastocysts, and yes, it does work effectively for day 6. Day 7, we haven't done any studies on day 7, so we don't know.
Okay. I guess that's like another area to actually look at, maybe day 7, because I think day 7 culture is also starting as a trend now in IVF laboratory. So I think our patients would like to know about that, because in Alpha, we do actually culture them until day 7. We do have quite a number of day 7 blastocysts nowadays. Okay, let's move on to another question. This is probably more applied to Dr. Lee. I'm planning to do PGTA already. Should I do AI instead? Dr. Lee, would you help this patient?
Do not allow the use of PGTA, which stands for pre-implantation genetic testing for the chromosomes in an embryo. Now, in those countries, yes, AI would be a tremendous help in the selection of an embryo for transfer. So in this particular question, we assume that the country allows PGTA to be done. And if someone is already planning to do PGTA, then should you go ahead or should you do AI instead? So that is the question. PGTA is a definitive way of checking whether the embryo is chromosomally normal or not. Yeah, it's definitive to a sense, because there's also some inaccuracies because of mosaicism and because of a concordance issue between what you check and what the actual situation in the embryo is. My answer to your question is that it is not an either-or thing, unless you have you want to consider issues such as cost. But as in many aspects of medicine, if you can have 2 types of tests, each having its own strengths, and then you combine the results together, then you end up having more information and tools to select something that will result in the best outcome. In this case, if you do PGTA and you get a normal embryo, and at the same time you use AI to select which of these normal embryos will result in a higher chance of a pregnancy, yes, it's better that you use both.
Okay, thank you, Dr. Lee. And there's another question here for Dr. Lee as well. If I have frozen blastocysts in another center, can I transfer them to your center for AI scoring to maximize my embryo choosing in embryo transfer? So, Dr. Lee?
Well, the simple answer to that is yes. And also, if the other center has the platform, and this can be obtained from Life Whisperer, you can also do the AI scoring in the IVF center that your embryo is already stored. But if that technology is not available there, then of course you can transfer embryos to a center that has this technology.
All right. Okay. Thank you, Dr. Lee. Dr. Michelle, is Life Whisperer the only AI application available in IVF?
At the moment, for embryo assessment using standard images from standard equipment in IVF laboratories, yes, it is. We are the first. There are a number of other companies actually developing similar technologies for time-lapse imaging systems, where they're a little bit different. They track the development of embryos over time in culture. But our system is quite unique and is the first that looks at that endpoint analysis immediately prior to transfer and making that assessment using AI at that point.
Okay. We have one really interesting question. Does AI analyze mosaic blastocyst features? Does it have a algorithm for mosaic blastocyst, Dr. Michelle?
Not as yet, but what's really interesting is that when we have assessed the effectiveness of the AI for genetic assessment, what we see is that, as I told you, the scores range between 0 and 10, where 10 is the highest score that relates to the most likely being genetically normal, chromosomally normal. Actually, what we see is that scores in the mid-range, around, say, 3 to 6, quite often contain the mosaic embryos, which makes sense if you think about it, because they're a mixed population of aneuploid and euploid cells within the embryo. So we haven't specifically looked at mosaicism, but we do definitely see correlations with mosaicism with our scores.
Okay, great. Then the next question, is AI still relevant for PGD? I mean, those embryos that already tested for PGD? I guess this is the question for Dr. Lee.
Yeah, the answer is definitely a yes. As in my first slide, if you have 2 or more embryos that had already undergone the PGD process and they are chromosomally normal, then you can then apply AI on top of it to help you to select which one to be transferred.
Okay, thank you, Dr. Lee. The next question is, for Frisian PGS tested blastocysts, does that mean that the blastocysts would need to be taught for AI analysis prior to transfer? I think this is another question for Dr. Lee.
Well, it depends on whether this embryo had undergone a one of the embryoscope, like the time-lapse embryoscopy, where you already have the pictures of the embryo before thawing, and all you need is just to apply the Life Whisperer platform onto this, and then you can do the scoring without having to touch the embryos at all. However, if these embryos did not have any photos, pictures taken beforehand, then yes, you would have to thaw them, and then I suppose you would need to thaw them anyhow at some stage before you transfer them. But then the issue would be that which one will you thaw first before you even, without knowing the AI information. So the simple answer to your question is, if they had pictures before, the answer is yes, you can just use those pictures and apply the AI. If the answer is no, they had no pictures before, then you have to thaw them in order to apply the AI. That would be right, Michelle?
Yes, that's correct. And the idea is that for consistency and for future thawing and information about the embryos, you would want to do the Life Whisperer analysis before you freeze the embryos.
Absolutely.
Yeah.
Okay, and then here we have another question. What is the difference compared to ES score? Dr. Lee, would you help this patient?
Okay, the ES score is the embryoscopic score, where it's also known as the KIT score, and it's also undergoing improvements. Now, this scoring has got its own system or algorithm of finally coming up with a score, whereas AI is basically using even more data and more deep learning. And if you were to compare the two, I would say that AI is derived using a lot more information, and therefore is probably more accurate. Now, we actually have a patient where there were 2 blastocysts. One of them had a higher ES score compared to the other, and the other one had a higher AI score compared to the first. So we actually chose between the two based on the AI score, and that was the first case that we actually did that I spoke to earlier, and which resulted in a pregnancy. So clinically, that's from the little experience that I have. I think Michelle can tell us a little bit more the difference.
I think they are a little bit different. You're right. The AI is looking at kind of really advanced computer methods to be able to analyze the features in those embryos. Excuse me. The Embryoscope score, or the KID score, takes into account a whole range of different inputs that you put in as the embryologist. So you need to do some annotations of those embryos, which can be a little subjective. You kind of feed in some of the scoring measures, whereas the AI is based entirely on a very large historical data set. And so it's completely independent, it's completely objective, and it's completely data-based. And so that's the difference there.
Okay, all right. Thank you, Dr. Misha and Dr. Lee, on answering that question. And we have another question. What is the cost difference compared to PGT-A? Dr. Lee, would you like to help this patient?
Okay, I suppose this cost is going to vary between countries and even between IVF centers. But here in Malaysia, in general, it is going to be cheaper to use AI compared to PGT-A. If you are talking about just strictly on cost basis, yes, I think AI would be cheaper.
Okay, all right. And regarding the actual price of the AI that currently offer in Alpha IVF group, you can actually contact the email address and also the phone number that listed below. We have some amazing ongoing promotion offered by all the center, so you can find out more information by contacting them. So I think that is the last question that we have tonight. And once again, thank you both Dr. Michelle and Dato Lee. So glad that we have both of you with us today to present us the latest IVF technologies. And so I guess that's the end of our session today. So have a great evening, everyone, and bye.
Bye. Have a good weekend.
Yeah.
Bye.
I know.